Can you get slimmer looking lower legs in just one procedure? In this video, we're going to take you step by step through the lower leg liposuction procedure. You will be able to see what's going on during the procedure and immediately after. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. So slimmer looking legs in just one procedure. Yes, it can be done with a lower leg liposuction procedure. In modern times, majority of the surgeons perform what's called tumescent liposuction procedure. So the tumescent solution injected in the lower legs to cause anesthesia, to numb them up, but also to extract the fat without major blood loss. So tumescent solution is a solution that contains usually lidocaine, epinephrine, or adrenaline that causes your vessels to shrink, and sometimes surgeons add certain ingredients to that tumescent solution. In my case, I add what's called tranexamic acid or TXA to minimize the bruising and to reduce the amount of blood loss. So after the solution goes in, we allow it to work usually for several minutes, and then the fat is extracted with that solution using different techniques. There are different technologies, but the most important thing about the liposuction, as I always tell my patients, is to pick the right surgeon. So it's not so much about the actual hand piece that's used for the liposuction, but it's more about how the liposuction procedure is performed, especially in the lower legs. So when we remove the fat comes out with that fluid that we put in, tumescent solution.
Yeah, you can see fat coming out in the tubing already. Getting rid of those chemicals, extra ankles. Patients frequently report that they can't wear boots. They're embarrassed to show their legs because of those fat deposits around the ankles. So we're working on that.
Majority of that fluid actually comes out. Some of it stays in the body. Your body just kind of absorbs it, and then you pee it out. And sometimes after the procedure, we leave some of the insertion sites open, so the fluid can leak out without causing the swelling for a prolonged period of time. The problem with the lower leg liposuction, first, it's a little bit more complex procedure due to the unusual shape of the lower leg. So there are multiple bony prominences, valleys and peaks, and so you have to work around those irregularities to create a nice and even result. Lower leg liposuction is prone to what's called contra-irregularities, a little unevenness, a little lumpiness. If you look carefully enough after any lower leg liposuction, you will be able to see some irregularities. However, if it's done well, majority of the patients really enjoy the great result, and they like how the legs look slimmer. They're able to wear shorts, they're able to wear boots that they were not able to wear before. Frequently, lower leg liposuction is performed for the condition called lipedema that's characterized by abnormal fat deposits in the lower legs, sometimes in the upper legs.
What happens here, actually our cannula frequently gets clogged, and this is not a small cannula. This is about 4 millimeter size, so this is a large diameter cannula, but it gets clogged all the time. And this patient has lipedema, and if you look at the fat here, you can see how granular and pale it is. Normal fat is fluffy, looks like an egg yolk. This is more granular, looks like Rice Crisps, and it's very dense. So if the particle is large enough, it just clogs our suction tubular suction cannula, and the patient had heaviness in her legs. She is very fit but unable to get rid of that fat, and it hurts at the end of the day. The legs get swollen, so this is that abnormal lipedema fat. There's I think it's less vascularized, that's why it's more pale, usually hormone sensitive fat. So the condition gets worse after pregnancy or during the teenage years. Let us continue working there. You can see great difference. Right leg versus the left one. Patient is awake, comfortable, but there's definitely quite a difference. If you look at if you pinch here, I can't even pinch the skin here, but I can pinch the skin here.
In this case, this procedure can be life-changing because your legs will look much slimmer, and people also get functional benefits. So they feel that their legs feel lighter, they don't bruise as easily, they're less lumpy, less heavy at the end of the day. So the procedure also has a functional component. Prolonged swelling after the lower leg liposuction is not uncommon. And the reason for that, this is the most dependent, the lowest portion of our body, so that we tend to retain fluid, and by the end of the day, frequently people have swelling in their legs. When we do the liposuction of the lower legs, no matter what technique is being used, usually you disrupt some of the lymphatic channels that drain the fluid from the lower legs, and it takes some time for your body to recover and to restore those lymphatic channels. They always get back to normal. So this is probably the only case when you create temporary lymphedema, the condition characterized by lymphatic stasis and accumulation of lymphatic fluid in the legs. However, in the vast majority of the cases, this is only temporary and it gets back to normal. I tell my patients you can have some swelling in the lower legs, sometimes up to several months after the procedure, but majority of the patients can get back to their regular activities and normal activities just in a few weeks. So I hope you enjoyed the video. I hope you find this helpful. Click like button and subscribe below. Thank you.